What if the vaccine meant to stop polio was actually carrying it? This is a story based on a real incident. 1955. After years of fear, a new hope had arrived, a vaccine against polio. Production had begun on a massive scale. Millions of doses were being prepared with one goal, a polio free future. Children were brought in, the vaccine was given, and the parents finally felt their children were safe. Then, a few weeks later, something changed. New cases of polio started appearing. One case became several, several became many. The numbers kept climbing, and now there was one disturbing question: infection or vaccine? The news reached the national health authorities. Doctors and epidemiologists were sent in. They had to find the answer. They went from family to family, hospital to hospital. They mapped the cases, looked for patterns, and followed every possible clue. Then the investigation reached Qatar laboratories, the laboratory which prepared the vaccine. The vaccine itself was now under the microscope. The investigators went through every stage: viral culture, inactivation, testing. Nothing was taken for granted. Three things began to stand out: formaldehyde, clumping, and time. Could these three explain what had happened? The polio virus was cultivated in batches, and during cultivation, the viral particles could clump together. Formaldehyde could act on the virus on the outside, but the virus trapped inside those clumps was harder to reach. So, while most of the virus were being inactivated, some could still survive. And then came the critical assumption. They believed that after a defined period of formaldehyde treatment, the virus would be completely inactivated. But the graph told a different story. Most of the virus were inactivated quickly, but the last surviving fraction took much longer. The problem was not simply the chemical, it was assuming that one time point was enough for each virus particle. And when that assumption escaped the laboratory, the consequences were no longer numbers on a graph. There were infections, there were deaths, and the vaccine program had to be stopped. The Qatar incident taught medicine a lesson that goes far beyond polio. In medicine, safety is not a probability, it is a responsibility.